So up here we have what the patient is doing. The C here stands for controlled. This means that the machine is delivering controlled breaths to the patient. So the first number, P peak, is the peak pressure, and this is measuring the pressure in the tubes of the machine, the airway of the patient, and the alveoli of the patient. Right now it's at about 41 centimeters of water, and generally we want this to be below 40. P mean is the mean pressure. PEEP, again, is the positive end expiratory pressure. And if we compare this PEEP value to the one that we set in, we can see that it's greater, and this 1 centimeter of water difference could be due to air trappings in the patient. Next, we have the IE ratio, which is the inspiration-expiration ratio. So what this is saying is that in 4.2 seconds, 1 second is being spent inspiring, and 3.2 seconds is being spent expiring. And generally, we want this to be about 1 to 2. Next, we have the frequency, and we can see that this frequency is the same frequency that we set in the machine. And this is saying that the patient is not doing any work and the machine is doing all the work. Next, we have the exhale tidal volume, and we can see here that this tidal volume is less than the tidal volume that we set in the machine. So this, the 100 milliliter difference could be due to there being a hole or a tear in the balloon of the endotracheal tube set in. So that means about 100 milliliters of air is leaking on the sides of, or the ends of the trachea past the torn balloon and escaping through the patient's mouth instead of the tube. And then finally, we have the minute ventilation, and this is the product of the frequency and the exhale tidal volume. And generally, we want this number to be between 7 to 9.